Jody, I think we're ready when you are.
You bet. Thank you. So I'm Jody Frost. I'm the president of the National Academies of Practice, and I want to welcome all of you, our new members, to the National Academies of Practice. Many of you have already been looking at information and things on that website. Many of you are being inducted. Congratulations on your induction as distinguished fellows and affiliate members, as well as professional members. What a great honor. So tonight is our new member virtual orientation. We typically do this in person, but last year we did it this way, and we had several of these that follow up to make sure you're engaged and connected, and they worked out terrifically last year with a class of 120 new inductees. So we've had some practice. We're in good hands, which is great. We can go to the next slide. Initially, we do apologize. We're going to be muting everybody. There will be some opportunities for Q&A and some engagement, but because of the numbers, it gets a little busy to be able to do that. But we do have places that we do want to hear from you, and we want you to have a chance to connect to one another as well. So if we go to the next slide. You know, we wish we could be in person to meet and welcome each one of you personally and shake your hands. But we know that this pandemic has changed the landscape when it comes to meetings, conferences, and getting to know one another. Nevertheless, we are resilient, adaptable, and creative, and have learned how to navigate the virtual landscape to still be able to share information, to engage participants, help them to better understand this organization, and available opportunities for engagement immediately. You don't have to wait. There are no dues to be paid. You can get engaged right away. And to meet the overall needs of our new members to ensure that you're well prepared to participate in the annual forum and business meeting that's this week, as well as a special class this year. It is our 40th anniversary celebration, which makes this even more special. You will be getting an email tomorrow that is your member welcome packet. It actually has information about the organization. You will be able to find it under your member profile. There is a new member orientation packet that has the structure, the bylaws, all of the details. We didn't want to encumber you first. We wanted you to just sit back and enjoy this. And then tomorrow you can look up the other information. Along with that, underneath that is our annual report for 2020. And our new strategic plan that comes out annually for 2021. And they're all under the member profile, our NAP bylaws, the current one. So when you log in and go under member profile, you can see a series of information. You'll be able to access that all, but you will be getting an email tomorrow officially giving you that information. So we're going to begin on the next slide with an opening check-in question. And we're going to have you do this in the chat, and then we're going to pull some comments just to get you started. So it's actually been almost a little over precisely 1 year. The pandemic was officially declared on March 11th. So we are 1 year post. What's one lesson learned or silver lining that you've experienced as a result of this pandemic? One lesson you've learned or silver lining that you've relearned, and just feel free to just chat it up. I love these. So everything from like technology is our friend when it may have been the enemy a year ago. Zoom now is like, you know, everybody knows how to Zoom and they know how to dress from the waist up. They don't have to worry what's below the waist. Your wardrobes are fabulous up here and who cares about the rest or if your feet are happy. Ray's laughing because it's totally true. I have jeans on underneath this outfit, so what the heck. Patience, resilience, adaptability, flexibility. I think people are learning how to deal with stress, strain, burnout, a lot of that going on. By a show of hands, how many of you are in clinical practice? Practice, great. And if you have your camera, we would love to see you. Thank you so much. We don't care. Zoom, everybody doesn't care anymore what they look like. And how many of you are in education, academic setting? A lot of it. How many of you do both? You have both practice and education in order to maintain your clinical competence. Any of you in public policy who are officially public policy, and any of you who are in the research scholarship area? Great. I've got people who've got multiple hands going up. Outstanding. I also see that a lot of us have learned patience. We thought we had patience. Now we really understand patience. It's become our new reality. Human connection. I think we took for granted the amount of time you could connect and connectivity, and the fact that our circles are much smaller, how we long for human interaction and connectivity and touch. And touching your screen doesn't work, by the way, but you also don't get COVID through the screen. So there's a plus for that as well. You can sneeze and everybody goes like this, but it's okay. Some of us who love travel found that working from home isn't so bad, I see here. Some people getting involved internationally, the opportunities to do that, even with the different time zones. And by the way, not caring about dress is good with the different time zones. Some people are in pajamas for those meetings. Problem solving, social justice reboot. The social determinants of health, which we knew are even more exaggerated these days. What we knew were shortcomings are clearly significant shortcomings. In person, I think when we're in person, there's going to be what I call a love fest. It's going to take us back to Woodstock, for those who know what Woodstock is. And there's going to be lots of hugging, connectivity, and drinking, whatever your choice is. I love the fact that people are learning about being resilient and able to thrive under extraordinary conditions. The human spirit is pretty amazing. It finds a way to find balance no matter what. So I'm glad to see all of you, and I'm glad to see there's a lot of lessons despite a lot of personal hardships and a lot of tragedies in people's lives, more than we ever imagined. I'm glad to know that all of us are resilient, and you're joining an organization whose interprofessional strength and culture makes it a unique place to be, almost like no other one, because all of you choose to be in this organization. It's not a professional responsibility. It's not part of your professionalism. It's out of choice. And it makes it very different in terms of a culture, because people want to be here. They want to connect, and they find that in this culture, it's a new ethos, a new way of sharing, and a new way of valuing and respecting people, even with difficult conversations. We learn to be vulnerable, we learn to be transparent, and we learn how to be humble in that sphere. So thank you for getting us connected and kicking us off. And I'm going to turn it over to my colleague, Rick Weisbarth, who's our president-elect and incoming president. Rick.
Thank you, Jody. Good evening, everyone, and thank you for being with us tonight, and congratulations on becoming a member of the NAP family. As you know, what's next is our NAP Forum. It's a busy week for us, and while we wish we could meet in person, we're going to have to do it virtually one last time. Fingers crossed. So this is a very special NAP meeting this year, NAP Forum, because it's our 40th anniversary. And there will be 40th celebration activities on Saturday. But the format that the meeting planning committee has put together is really great. And it's going to allow for learning, networking, connecting, and an opportunity to meet the sponsors. So we think that this virtual meeting will be the best virtual meeting that you've attended in quite a while. And it's filled with a lot of activities. As you can see at the bottom of the page here, there is specific information about the annual forum, and you just have to go to the website and it'll take you to the link. So we hope that you're able to join us on Thursday, Friday, and Saturday. And because you're part of the class of 2021, we will welcome you and honor you on Saturday evening, and more to come on that in just a few minutes. So up next, I'd like to tell you a little bit about our service project. So Melanie, if you could advance to the next slide, please. Normally, under normal circumstances, the meeting would be in Washington, D.C. But we decided that since Washington, D.C. was our host city in the real world, we would continue to honor and do something for the local community. So we have two service projects lined up this year. The first one is Charity Miles, where for any movement activity that you do, you can earn money for one of two charities that have been designated in the DC area. And then the second activity is a shoe donation drive, which will help the Central Union Mission and provide much needed shoes to the homeless population in the DC area. So once again, there is further information on the website, and there was an email sent out last Thursday, the 11th, to all NAP members that goes into great detail about both the charity miles and how to set that up on your smartphone, as well as information on the shoe donation drive. So we hope that you would consider helping us support the DC community with one of those or both of those service projects. Next, I'd like to talk about the virtual induction that I referred to just a few minutes ago. As new members, you're part of the class of 2021, and we will celebrate the new Distinguished Fellows as well as professional members on Saturday evening, which is the 20th, starting at 5:30 p.m. Eastern Daylight Time. And what we will do is we will introduce the new members alphabetically. There'll be a slide with each of you featured. And then following the induction ceremony, we're actually going to have an open Zoom session where you can connect with colleagues and talk to one another and congratulate one another. Then on Sunday, the following day, we will have a link to the actual ceremony that you can share with friends and relatives that will allow them to see the ceremony virtually. So that's what we have planned. If you are a new professional member, you should have received a NAP certificate and a pin. And for those being awarded the Distinguished Fellow, Affiliate, or Honorary Fellowship, you should have received a medallion, a certificate, and a pin as well. If you have not received those items by this weekend, please contact Melanie at the NAP office and we will get those sent out to you ASAP. They are in the mail, but you know how the mail is working these days. So if there's problems, please let us know. Next slide, please, Melanie.
1 second, Rick, I want to just intervene as my colleague. I do want to give a shout out. We have a brand new academy, and so you're going to see some members here from athletic training. They are our newest NAP Academy, our 14th Academy, and the chair of that academy is actually Anthony Breakback, who's right if he puts his hand up, but we wanted to give a shout out. We've now added our 14th Academy to the National Academies of Practice. So congratulations to all of those who are athletic trainers and who are joining the NAP family and our other 13 academies.
Thank you, Jody, and my congratulations to the athletic trainers as well. On Saturday during our business meeting, Tony will actually be presenting a short presentation on athletic trainers and how they fit into the NAP family. And that's when we're going to officially welcome them as the entire NAP membership. So that will take place Saturday during the business meeting. Networking opportunities is one of the hallmarks of the National Academies of Practice. We pride ourselves on the fact that we have 14 different academies with different healthcare professionals, as well as an associate collaborative group. And these professionals, as you may know or will see shortly, interact with one another on a very frequent basis. And therefore, networking is a very important part of the NAP family. There are going to be a variety of ways to network during our virtual forum. There'll be lounges where you can interact with one another. We will have on Friday academies as well as the associate collaborative group meetings. That's Friday afternoon from 3:45 to 5 p.m. Eastern time, where you'll get to interact specifically with colleagues in your own academy or profession. And then we'll have breakout sessions or breakout groups during the business meeting and town hall, which is on Saturday, which is from 12:30 to 2 p.m. Eastern Daylight Time. So a variety of different ways to interact throughout the virtual forum. Then we also pride ourselves on the networking that takes place year-round. And that can happen vis-a-vis your academy meetings, committees that you may be a part of, through base camp for your specific academies. And then we also have our newsletter, the Knapp Times, which is issued bi-weekly on Mondays. So we encourage everyone to stay connected with the National Academies of Practice, and we really want your contributions and participation as we move forward. I'm going to turn it over to Jody once again, and she's going to talk a little bit more about advocacy and public policy within the National Academies of Practice.
So one of the strong reasons people are part of this organization, among many, is that it is an interprofessional public policy and advocacy organization, and it's one of the few that actually does that role. So you'll see that the Public Policy Committee takes a leadership role in helping to identify and narrow our message to the Hill, considering the timing, election cycle, issues coming forward in January, February of each year, and a focused message priority identified by our membership through a survey that's administered every other year. So it bubbles up from our membership, what is the priority message? So every other year when our conference is in Washington, D.C., we go to the Hill, and we go to the Hill as interprofessional teams. So interestingly, how many of you have done advocacy for your profession, gone to the Hill or your Senate state? Okay, how many of you done interprofessional advocacy in teams? You're in good company, because when we asked that question 2 years ago, we got the same response, which is we have no idea how that looks. We know how to advocate for our profession, what we want. But interprofessional advocacy is not about our profession. It's all about the patients, the families, and communities. The reason it works is it's not about our profession. It's the patient is at the center of all that we do. That's how this uniquely works in this organization. So this year, we are doing for the first time, another first. There's a lot of firsts this year. We are going to be doing virtual Hill visits and interprofessional teams. So not in person, but virtual. So we still need you to register. There's no fee, but we need you to register on the website. There is a place to check and register that you want to participate on the virtual Hill visits. And they can be anytime between 9 and 5. We're working with a company that does schedule them as they would do it on site. And by the way, all Hill visits right now for anyone are virtual. No one is allowed in person on the Hill right now. So we need to know the number of people doing this in order to put you in the teams, to go to whether it's a representative or senator and the staffer, to know how to put the teams together by state. And they may mix and match contingent states. Sometimes we have people flip back and forth. So it's our first time doing that. If this is your first time ever doing a Hill visit, we've got you covered. We've got some information. So during the conference, there is a session on virtual Hill visit preparation, and that's March 18th from 3:45 to 5. It's during the forum. It also is recorded, so you can go back and hear it if you're not able to actually hear that session. There is another session, which is the overview of the Hill visits, the logistics themselves, and what our core messages are, along with some resource material. And that's going to be held April 12th from 4 to 5 live. It will also be recorded. You can go back and listen to the recording. So you know what the topic of the message is around this year. It's telehealth/telepractice. And that's central for all patients, because we've learned through COVID, some patients, it's the first care they've ever gotten is in a telehealth visit. They have never been to a physician's office, and they actually did that. And we've had teams working under the leadership of our VP, Joanne Wisely, that's actually picked up rural and areas that have no internet or Wi-Fi, how they still can get telehealth services. So there's a lot of information that's been put together by massive teams in the public policy and advocacy area. You're looking at somewhere around 55 people have helped to put this whole thing together. So mark your calendars. If you haven't registered and you have that date available, please go ahead and do that. It is an experience you will never forget. We tell the stories, we provide messaging that's core and central. When we went 2 years ago, we actually went to let them know that we existed as an organization, and we might be able to help them out of some boxes and solutions that are uniprofessional to something that's interprofessional. We had a resounding response from Capitol Hill and calls for information about ways that we could actually help them, including we're one of the primary respondents to CMS and SNF, and we've actually gotten personal letters back from CMS as an organization on comments we've made about SNF. as an interprofessional language and organization. So we hope you can all be there. It is a fun experience. You go to a visit and you may be with a physician, a pharmacist, a speech language pathologist, and an OT. It's so different and so much fun. If we go to the next slide, please. NAP has year-round professional development, but it's customized to what our members want. Well, it can be webcasts. We're working on podcasts. We have working on CEs, but it's based on a response to an annual member survey. And it also includes content that is included in our annual form, along with things that precede and follow the form. They are customized. So last year, they were in the 4 dimensions. There was something on writings, grants, and scholarship for interprofessional grants. There was a group, Interprofessional Research.global, that talked about interprofessional global research you can get involved. There were 3 webinars on advocacy, and there were 3 webinars on collaborative practice models that people are using in different settings. So they really customize to what this organization is involved with. Sina Haynes is our VP for Professional Development, and she leads a professional development committee in this area with annual oversight for the forum and our 2 NAP member co-chairs. They're all volunteer, many active volunteers in the forum committee. Again, that is a large committee, and it's one that many of our new members get involved in early. That, public policy, the forum committee are also professional development, ones that people gravitate to and get a chance to put their toe in and dip into volunteering in NAP. And the next slide, please. So MAP, member interconnectivity is, interconnectedness is one of our core values, 4 core values. We have 2 things that we're involved in right now. One is called NAP NetCon, or networking connectivity. And when you signed up for your annual dues, there were 2 things you were asked to fill out. One was demographic information, because for the first time we're getting some of the demographics. It's hard to know how to do DEI if you don't know what you have in your organization, so we're starting there. And the second is we asked for your experience and expertise across 4 domain areas. Those are scholarship, education, higher education, public policy, along with practice. And it's designed that we're going to have search engines that you can begin to search on NAP NetCon for individuals in the organization within your academy outside of common interest and experiences. So if you'd like to do some collaborative work and research, collaborative models, you'd like to look at how collaborative practice, similar settings and practice, we're going to be able to do that. It's something that our members have really asked for inter and academy connectivity. If you want to do a research or presentation together, all that's going to be available, but we need people to complete it. It takes up to 7 minutes to do if you have to fill all them out. If you have expertise in every area, 7 minutes. It's not much, but the outside bang we get for the buck is you get to, within the membership, connect to your colleagues for information, for things you want to do. The second thing is around diversity. We're now getting current member demographics. And our membership committee, Laurel Abruzzi of Physical Therapy Academy, is actually working and leading the initiative in DEI to address strategies in the organization around diversity, equity, and inclusivity beginning this year. One of our 4 core values beyond interconnectedness and patient-centeredness, collaboration, and in fact, inclusivity. Those are our core values. So both of those are newer initiatives, and they're both designed for connectivity and helping to advance this organization in the future. Back to you, Rick.
Thanks, Jody. As you can tell, we're a very active organization, and we pride ourselves on the fact that 35 to 40% of our members are involved in some way, shape, or form. I don't know about your individual professions, but for my profession, that's way higher than I see. So it's a group that likes to interact and network, as I mentioned earlier, and be involved. So there's a number of different ways that as members you can get involved. And there's going to be a survey coming out in the next couple of days to allow you to express where your interest is. And when it comes to different potential ways that you can become involved, we have a number of committees and working groups. Advocacy, as Jody mentioned, is key. That's one of our committees. We do have town hall meetings 3 to 4 times a year that you can become involved in. And then as far as leadership positions, we have a forum committee that's already going to start working on 2022 when we'll be in San Diego next year. We have the Public Policy Committee, Professional Development, Scholarship Committee, and Partnerships and Networking. We also have other committees and groups that have appointed members, so there is ample opportunity to get involved in NAP, and if you have an interest, we can find a spot for you. So next, what I'd like to talk about is helping us bring additional colleagues into the NAP family. So starting on April 1st, we will start accepting nominations for the class of 2022. And we really want to continue to grow the National Academies of Practice members. As you know, we have the professional member category, we have the distinguished fellow category, and we also have the associate group, which is for individuals who have an interest in healthcare, but whose profession is not represented with an official academy. So we encourage you to think about those colleagues that you interact with on a day in and day out basis, either in your profession or in other healthcare areas, and seriously consider nominating them to be a member of the class of 2022. There is a member recruitment toolkit, which can be found on the NAP website. And included in that toolkit are an introduction area, a PowerPoint template that you could use to present at a professional meeting. There's talking points, and there's peer-to-peer template or sample email messages. So please help us to continue to grow the NAP membership. And what I'd like to ask is consider nominating at least one new member each as we move into this new term coming up, which starts right after the NAP forum. We recently surveyed NAP members in terms of why they choose to be a part of the National Academies of Practice. And what we came up with is a value proposition with the top 8 reasons to be a member or to be a part of the National Academies of Practice. Number 1 is the community and connectedness centered on total care of patients, family, communities, and societies. Number 2 is the professional recognition by healthcare peers, which is different than the professional organizations that we may belong to as a result of our given profession. That is recognition typically by our peers in our profession, whereas in the NAP family, it's professional recognition by other healthcare professionals and colleagues. Number 3 on the list is interprofessional and intra-professional collaboration for scholarship, education, and practice. Number 4 is opportunities to influence public policy through the interprofessional advocacy, which Jody has described. Number 5 is a culture of diversity, inclusivity, mutual respect, and transparencies, which live up to the values that she talked about. Next is engagement, customizable to your own interest and expertise, and that's where the professional development falls into place. Number 7 is professional development and well-being attuned to members' needs and interest, and leadership development interprofessionally as well as intraprofessionally. So those are the top reasons that our colleagues have joined the NAP family, and reasons why we want to continue to recruit others to become a part of our organization. Next, we'd like to open it up for questions that you may have relative to the NAP organization. And we will take questions either verbally, Melanie, or via the chat function. Is that correct?
Yes, that's fine. And I do believe that everyone should be able to unmute themselves. If not, feel free to raise your hand and I can unmute you.
So don't feel shy, because this is the chance for you guys to get to know each other. That's why I had you put in where your academies are, because you can begin to see some of you are from similar different academies. But one of the things is I wanted to ask about how many of you have ever been to a conference where there actually are self or well-being sessions like yoga, meditation included in the conference virtually? Good.
Not virtually.
Yeah, we're doing it virtually. So we've got a yoga session. Our VP for professional development is actually an expert yoga instructor and has a side business on top of it. And she's also a dean of a school, and she's a pharmacist / respiratory or dietitian, nutrition. She does it all. She's amazing. But we have that. We have a meditation session. So we've actually built in what is the fourth quadruple aim, or the well-being and self-help, in this interprofessional conference. It was going to be on site because there was one that actually was going to have also with the meditation, the herbs and stuff. Yeah, but we can't do that part. You can do your own, but we can't have the nice smelling stuff. Unfortunately, that was going to be in the room. So maybe next time. So think about, as you're entering this conference and you're thinking, oh my gosh, what have I just gotten myself into? And I will let you know, I have only been a member since 2014 when the PT Academy was a new academy, and I'm serving as president. So I'm here to tell you, there is not like typically profession, you have to give 20 years before anybody will notice you. Somehow I ended up in this position, and I co-chaired my second year, co-chaired the forum in NAP. So what I'm telling you is, if you have an interest, areas of expertise, a passion, pursue them, pursue them. This is the place you can do that, because you're all coming in and you're at the highest level of your profession interprofessionally. You're not novices, you're highly experienced. And we know that. We know the talent in this organization is unprecedented and remarkable. So what are you thinking about as you head into the meeting and you looked at that agenda and you clicked on all the things you want to go to at the same time, which you can?
And Jody, questions don't need to be just confined to the forum. They can
be about anything.
Academies of practice.
I have a quick process question. You guys can hear me? Jody,
Yep.
I see that you said in the chat you can nominate within your academy or for other academies as well. So we could nominate colleagues from nursing and...
Absolutely.
Okay, good. And
absolutely.
Then my other question is, I have a program manager who's full-time in our interprofessional education school, but she really doesn't have a healthcare background. Could she be an associate member?
Yes.
Okay.
We have a cultural anthropologist who actually is chairs that group. There's an associate collaborative group.
Okay.
And they have a voice on the council. They don't vote, but they sit on the council and have a representative. And Tony can talk about that, because athletic trainers were a part of the associate collaborative group, who are now spinning off to an academy. And Rick led that group. So Rick can certainly talk about what that's involved.
Do they have to have like a certain college degree though, or something? Or is there any minimum criteria?
Nope. Students can do it as well.
Okay, great. Thank you.
Yep.
Jody, we have a question about, will the sessions be recorded in case there's one they're unable to attend?
Melanie?
And the answer to that is yes.
I'm going to let Melanie, by the way, Melanie, who did not introduce herself, she is the executive director of the National Academies of Practice with AMR. And Melanie, maybe you'd like to just introduce yourself, a little bit of background of what in the world you have to manage.
Okay, sure. Well, I am Melanie, and I know I have already met and worked with several of you. And those of you that I haven't met, you've probably gotten an email from me or an email from Alexa Bell, who is our program manager with NAP. And as Jody mentioned, we work at AMR. So you'll notice our email is at amrms.com. AMR is the management company that staffs many nonprofit associations, NAP being one of them. And so Alexa and I are our primary staff for NAP. So you'll see our names a lot over the weeks and months to come. We work with the various committees, with the executive committee, the board, certainly event planning, webinars, all activities that NAP produces. We have touch points with them. And I can't answer, Rick, you're spot on. We are recording the sessions from the forum. So we do have some concurrent sessions that are competing against each other. So unlike when we're in person, that is one of the benefits to the virtual platform, is that you can choose one and still see the other concurrent session because we will record those. And we will make all the content available to everyone who registered for the forum up to a year afterwards. So you'll be getting information about where those recordings will be posted. We'll be recording the Q&A sessions as well. So you will be able to still access that information even after Saturday.
So, and I'd like to do a shout out to Melanie and her staff at AMR. Those of you who are commenting that Accelerant is an easy, intuitive way to navigate, you click and it shows up. They are the ones who did all the research and the homework to find us a user-friendly, functional, affordable platform that can still allow us to have connectivity person to person and not blanking it out. So my hats go off to her and her team. They are amazing. They are probably one of the best executive management teams I have ever worked with. And you all think that they have hundreds of people. They do not. 2 of them and 4 that help us out. That is it for this organization. They walk on water. They're the wind beneath our wings.
Well, thank you very much. I do want to say I appreciate the comments. Certainly, we do think that the Thursday when you enter the hub for the virtual event, that should also be a very smooth and easy to navigate site. But we will be available, and there'll be FAQs on the site. We'll be available to help answer questions or troubleshoot things if you need it. So definitely appreciate that feedback, and appreciate feedback on the evaluation that we'll send out after the forum as well. Things that you really liked and things that you wish could have been different. We appreciate all that kind of feedback because it helps us put the right tools in place going forward.
Other questions or comments or thoughts, all there, all questions are welcome. We're used to getting lots and lots of questions. Sure. What are our funds or dues used for? I'm going to tell you, we have a treasurer who actually has served 2 terms, and he's not allowed to do any longer than that. But he has managed, along with Melanie, our budget process. I will tell you, many organizations with the pandemic have suffered tremendously financially. And if their conference was their sole way to balance their budget, they've been in trouble. We are fortunate that we actually use registration directly to offset the conference, so we don't go in the hole. And our members' dues is to do our strategic initiatives and the overhead. So it's actually done in a way that always preserves and safeguards the interest of this organization, which is not huge. We have 763 members. And because of that, we have to be very careful about how we budget and finance. So your dues are used for a number of things that happen. The platform that you're using for Accelerant, the registration, obviously there's a fee for the platform and all the recording and the Zoom links, et cetera. And we also have sponsors that help us offset that those costs as well. Our 40th anniversary celebration obviously has costs involved, and the donations were used to offset that directly. And frankly, the donations can only be used for the 40th. They can't be used to offset another thing, just like our sponsorship has to donate or do specifically for this event, it's used directly. Your membership dues are used partly for anybody, an administrative overhead. That is the work that happens behind, but there are other things that those dues are used to provide for. The professional development opportunities that are customized, whether they be webinars, the CEs, the podcasts, et cetera, all have costs associated with them that are directly geared to that. Going on the Hill, whether it be virtual or live, has cost involved. And we are a 501(c)(3), so we have to be very careful about what portion of our budget is attributed to advocacy. We have to be careful. We do have, our organization is a member of the National Academies of Science, Engineering, and Medicine Global Forum on Innovation and Health Professions Education. We are the only interprofessional organization of 50 that are a part of that. And we bring a unique lens. There is a cost for that, but the lens we bring in interprofessional is also heavily oriented in practice, not just education. So when they talk IPE and forget that the real part of IPE is ICP, right? We're there to remind them everything you do for learnings and clinical teaching had better do something in the outcome in a quadruple aim or it doesn't work. And we have two representatives. So the president serves as the designated chair or the delegate, and our president-elect is the alternate. So Rick will be stepping in that position as I step out. But I actually am fortunate. I'm one of the workshop co-chairs in April. So that's something that happens. And we also, with that global forum, we have done some collaborative work, and the social determinants of health resources that live on our website were a result of a workshop where they can only do proceedings, and we partnered with them to with focus group to bring it on our website for free. And they are phenomenal resources for teaching in the classroom and clinic with case studies you can use directly, slideshows, etc., on social determinants of mental health. So there's an example of something that is part of a partnership. So they are all aligned. We have in our budget, we are actually can share what strategic initiatives are actually important to apportion to what budget alignment. So those things that are outreach, community outreach, scholarship, et cetera, we actually have them aligned directly in the budget with our strategic initiatives, and you can find what those are. Does that help? We don't waste much money in this organization because we don't have it to waste. And by the way, it's very transparent. You can get that budget or see whatever. And at our annual forum business meeting, he is going to provide a treasurer's report so you can see exactly what happens. We actually have an amazing reserve. He has gotten our reserve from what was little to an exceptional reserve. And that reserve actually protected us last year when we had to cancel our forum 3 days before the meeting last year. And the day after they declared a national pandemic. And we're still in a good place. Thanks to Melanie and her organization and to our treasurer. Other questions? We told you we're transparent. We're pretty honest here.
Jody, you used the acronym ICP, Interprofessional Collaborative Practice, but I've seen IPCP.
Yep,
used more
ICPCP.
frequently. Is there any consistency? Is there a preference? Is there?
Yeah, Michelle, that's a great question. So last year, we had a task force, and Andrea Feifel, who's our incoming president-elect, actually chaired that task force. NAP now has an official lexicon that we use. So the Tower of Babel with 14 health professions and others does not exist. We actually have, it is under that member profile, you'll see the NAP lexicon. There's also a citation if you need to reference it for anything. We have provided a citation, and the work with Andrea and her committee is exceptional. It is dynamic. So as things change or evolve, you may find some new terms on there. Remember that this lexicon not only serves all of us, but it includes veterinary medicine. So patients, clients, we really have to be broad-based and inclusive when we talk about vet med to optometry to dentistry to medicine, really looking at what those terms are. And so in our publications, in our NAP Times, and our communications, we use the standard lexicon now. That's now our official lexicon, and we change it to make sure we're all in agreement. And when we read it, we all know what it means. We can go back and see the same thing, which is a first.
Is there coordination with the National Center or the American Interprofessional Healthcare, those organizations? Because I think that's where I see IPCP used a lot.
Yeah, so
a lot of
there's this is specific to NAP.
right.
And Andrea and her team does have references cited if it's the World Health Organization or it comes from CIHC or whatever it is in there. But we're unique in that a lot of the interprofessional organizations may not have the same constituents members that we have,
Right.
Where vet med is not included in some of them, and it ought to be, I might add. So it's unique to us. I will tell you, Barbara Maxwell, who serves as part of the member of the Interprofessional Research.Global, is actually doing a study with that group to create what it would be an international lexicon for interprofessional. But they're actually referencing and using our document as part of their work as well. They're going to be doing some modified Delphis across the globe. So it's a first, it's a place to begin. And if people are looking for something to cite in their institutions, at least you have something to begin with a citation.
Thanks.
Andrea, did I leave anything out? She's on by phone and she's driving.
Can you hear me?
Yes. Did I leave anything out?
Can you hear me?
Yes.
No, you did a great job. Yeah, and I just want to emphasize that that document and that work is iterative. And so as you begin to use it and consider what's there, there will be an opportunity. I believe we decided every year. Am I right about that, Jody? To
Correct.
take a look and see what we might need to modify, change in order to serve our members better going forward.
Great questions. Keep them coming. By the way, Melanie is putting up where the lexicon is, so she can show you right there.
Yeah, so it is on our website under resources, the NAP Interprofessional Practice and Education Lexicon. So it is
And if you scroll down a little bit, can you scroll? You can see there's a preamble for certain things like health workers, but you'll see that there's definitions, and where a reference exists, the reference is cited. Other questions?
Jody, there's one in the chat, a Gestalt question. How does NAP advise governmental bodies?
So let me start with, if you read the history of NAP, which is now 40 years old, 1981, it was established by Dr. Nicholas Cummings, a psychologist, and he had a vision back then. He was actually sitting in Congress, and it was around a Medicare bill, I might add. And he looked at each profession in the room, advocating for each profession. And he, I guess, had a bit of disdain that this was not good practice, that somehow we really didn't have the patients front and center, and we were actually not collaborative. And so he envisioned an organization that would have people at the top of their profession who would actually, because of their expertise in their profession, would be able to represent the organization interprofessionally. So in our public policy, they do advocacy, but the committee is public policy. So we actually have on our website, and maybe Melanie can pull that back up again, we have some position statements that have come forward. Of recent, you'll see them done, and part of the position statements are in response to a request. So one of them that we did with the National Academies of Medicine was on opioid epidemics and disuse, and NAP actually signed on as the only interprofessional organization. But one of the things we have a group working on is to create an interprofessional training around substance abuse and disuse. So rather than a profession specific, it really requires an interprofessional. We have a position statement that was done on clinician well-being. There's one recently that was done on, we have a relationship with the Office of the National Collaborative, ONC, and we've helped them with health information technology, but we're one of 5 top tier organizations that advises them from an interprofessional's perspective. So when audiology says we can't use your technology because you don't have our testing on it, it's an important thing why we can't use what is the prefab. We also have a relationship with CMS. We've commented on their skilled nursing facility problems that they've had in the language, where we made I would say multiple suggested edits, of which they took all of them and moved them into the document, where the words they were selecting were leaving professions out of the document in skilled nursing care. So you can take a look at those position statements. They are done often annually, and we have a review committee in the public policy group that actually looks at possible position statements to determine whether or not they're appropriate for us as an interprofessional organization. So we've had requests from single professions to sign on, and that's not what we do. The professional organizations that each of you belong to can do that. Ours is always an interprofessional perspective. And so if it's something that impacts all of us, like telehealth, like clinician well-being, like health information technology, like opioid abuse, we sign on to those and we figure out, and we have a group that does some research in order to write those position statements. When it's a single one, it's not that we don't want to, it's just not appropriate for this organization. And then we always have our advocacy. Go ahead, Rick.
Jody, I was going to say, and when we do a position paper, that's still another way that our members can become involved. So it doesn't have to be involvement 365 days a year. It's involvement relative to where people's passions lie. And we need people with different backgrounds to support all the different activities that we engage in.
Rick, thank you. And it brings up, so for instance, when we were going to sign on to the one about opioid, we put a call out on our NAP Times for people with expertise in that area. And we got some phenomenal responses that formed the group. And I will tell you, in 1 week, they wrote the position paper. We had 10 days and they put it together. And if you take a look at that position paper, it is phenomenal. 10 days. And it's because of their background. Ray's looking, I'm like, it's because of their expertise. One of them advises the government in their own state on how to manage that. And he's a prolific writer. So one of the wonderful things about NAP is the people you meet are phenomenal. They become future mentors. They become future colleagues. You can't believe the people you get to talk to, and you think, wow, they're all in this one organization and they're all in the one place together. How could I be so lucky? Normally, I bring tons of cards with me to the conferences because those cards are how I connect to everybody. We're going to be able to do that differently here, but it's a chance to get to really connect to people that otherwise you might not have the opportunity to do. Other thoughts, questions? Make sure that when you get in the lounges, you ask people a little bit about their background. The NAP NetCon is a place that you're actually going to really be able to connect. One of the speakers for the conference, the keynote speakers, is also being inducted into the Allopathic Osteopathic Medicine Academy, and she is known internationally. So yeah, she is known internationally. She's actually a physician / pharmacist / public policy fellow. And has an interesting story on top of that. So like I said, the people in this organization and all of you sitting here have remarkable stories or you wouldn't be a part of NAP.
Jody, I do want to go back to one of the previous questions about the sessions being recorded.
Yes.
They are all recorded with one exception, and that one exception is the keynote that you just mentioned, Dr. Anita Gupta. She has requested that her presentation not be archived, so we are honoring that request. And I mention it just from the standpoint of I don't want anybody to miss it and think that they'll be able to view it later. So that is the only exception. And then also on workshops, we will record the workshops, but if there are breakout groups in the workshops, we will not be able to record those individual breakout groups. So I just wanted to set the record straight so that we all have the same understanding.
Thank you. And thank you for that reminder, because I'll have to remember that I can't miss anything I don't want to miss. And I understand why Dr. Gupta wasn't, because she speaks internationally. Her material is, you know, it's her intellectual property. I don't think she wants that necessarily recorded or shared. Any other
Very
questions? I have 7:54, so I want to make sure we end up time. I'm always, people know me. I'm sort of respectful of people's time for being here, but I want to make sure if there's anything else you want to know now. And if you've had the questions afterwards, you're welcome to still email Melanie, myself, or Rick. We may not get back to you right away with the conference coming up, but we promise we'll get back to you.
Valerie, did you have a question?
I did, yeah. I was wondering if NAP is still using Basecamp, because I thought I was on, and maybe I think I am, on the Advocacy or Public Policy Committee, but I haven't heard anything in a while. And I didn't know if that was just because, you know, the pandemic and, you know, we were just managing, or if something moved and I got lost.
It hasn't moved. So great question. And I appreciate you asking about that. There are certain committees and certain academies that are using Basecamp Group. So the public policy subcommittees have not moved where they're working out of. So I'll double check, Valerie, just to make sure. I know some people have had an issue with a different email address being in Basecamp than what. So I'll double check and make sure that it's on there.
Thank you, Melanie. Can you guys still hear me?
Yeah. Yes.
Yeah,
Yes.
I'm frozen. When there's this many people, I freeze. As long as you can still hear me, we're good. I hope at least I didn't freeze with my mouth wide open. Any other questions from the group? If not, why don't we go to the last slide, Melanie?
So what we'd like to do is ask you one last question, but before we do that, I just want to say I hope tonight has been informative, and we are so looking forward to you becoming an active part of our membership. So As Jody mentioned, if you ever have any questions or thoughts, please feel free to share them with us. We're more than happy to listen. As far as our checkout question tonight, we've mentioned quite a few times that we are a learning organization, and subsequently we want to learn from you. So the question that I'd like to pose to you as a checkout is, how did you become interested in NAP? If I can have you fill in the response to that in the chat. We're really interested in knowing how you became interested in NAP, and hopefully applying that as we try to recruit additional members to our NAP family. One of the things that you will hear on Saturday as you're starting to fill that into the chat function is how much the organization has changed in its 40 years of existence. What the organization was when Dr. Cummings started it and where we have trajected over the last couple of years has been phenomenal in terms of the advancements we've made. And we really look forward to continuing on an exponential rate of growth and development and learning from one another. So we thank you very much for your thoughts and for participating tonight. And as I say, we look forward to seeing you at the forum and many other NAP functions in the days and weeks and months to come.
Melanie, can you still hear me?
Yes,
Okay. Can we go to the last slide?
yes.
So for all of you, please enjoy the forum this week. It's an exceptional offering, and I think it's probably going to be one of the most dynamic virtual meetings that I've ever gone to. We look forward to the 40th anniversary celebration, and there will be a celebration. Hopefully all of you who have registered have gotten your glass that you can fill with whatever you choose to drink. The conference is going to be remembered because it is innovative, it's engaging, and has professionalism and interprofessional opportunities for connectivity. So together, we are transforming interprofessional healthcare for patients, clients, families, and communities and society. And only together can we make a difference. Thank you all for coming and joining. I look forward to seeing you all at the forum in 2 days. And please make sure you have a chance to connect with people. Don't hesitate to ask questions and to try to find a way to begin your networking. It's now is important, and don't hesitate to volunteer either. We welcome volunteers.
Thanks, everyone.
Thank you, everyone.
Thanks,
Have a
everybody.
good night. See you soon.